an area of interest. So thank you very much for joining us.
Absolutely. Thank you very much and for the introduction, and thanks to all of you for coming out. I'd like to especially thank the Environmental Health Sciences Department for inviting me. It's a real pleasure to be here. So I am at Michigan State University. I will be doing a sabbatical in LA next year if everything goes as planned. So it's especially great that I get to be here and learn a little bit more about what you guys do and see if we have some shared areas of interest. What's that?
Where are you doing the sabbatical?
At Rand Corporation in Santa Monica. Yep. So a little bit about me, just so you know where I'm coming from. So I do not have a background in the health sciences, my disclaimer here. I have a background in ecology and environmental science. And my work with public health scientists and folks in the medical field has been more recent. So I kind of started out in a more traditional ecology program, environmental science program at Brown University, and then I did my doctorate at the State University of New York Environmental Science Campus, as was mentioned in the introduction. And during that doctoral degree, I moved into, from what I would say is a more traditional ecology approach to a more kind of coupled human-natural systems focus. Because in between college and grad school, I lived in the Philippines for a year in a development program, and I really saw firsthand how problems of environmental degradation and poverty and human well-being are inextricably linked. And there's no way to kind of take humans out of the equation and look at nature in the absence of humans. You have to think about both of them together. So I did my doctoral work on soil conservation and soil erosion in the upland Philippines and looking at farmer livelihoods connected to that. And for that dissertation, I learned how to model. I learned how to build simulation models on the computer depicting how systems kind of evolve at each time step. I'll show you guys an example of that later. And as part of that process, I did a lot of literature review on farmer conservation techniques, how farmers think about conserving soil. And the literature was fairly united in its view that farmers do not implement soil conservation practices because either they aren't thinking long-term, they might be renting the land, or they don't know how to do it. This was kind of the consensus. But when I actually was in the field and talking to farmers, I found that that was largely not true. I found that farmers were actually doing a lot of things to conserve soil. And oftentimes those actions were not very effective because they were farming on extremely steep and marginal lands, particularly the poorest. So I began to see this as more of a kind of systems problem related to how people have access to land and less an issue of people not having the tools to do it. And it also kind of put a seed in my mind that, it's really important to involve the people who are intimately, inextricably linked to the system in the model that you build. Otherwise, that model may not portray the whole truth, right? So I took that learning with me to my postdoc at the University of Minnesota, an ecosystem science and sustainability initiative, where I was part of a really innovative program that was designed by my former boss, Ann Kapuscinski, who's now at Dartmouth, and Richard Bawden, who's now in Australia. And their vision was to have communities around the state of Minnesota design kind of sustainability programs and invest small grants that were given to them through the extension program at the University of Minnesota. And our role was to help support that decision process by helping them think about the future in a kind of systemic way. So they did some scenario planning, and we supported that with some quantitative modeling. And that was my first experience with really doing what I would call participatory modeling, in which the people who were doing the planning, the stakeholders, were involved in the creation and the structure of the model. And I fell in love with it. I saw what a cool tool it was. And I started exploring this more and found out that there are actually quite a few people doing this and working on it around the world. Started learning more about it. And so now I am what I would call a participatory systems modeler at Michigan State University. And I work primarily in West Africa and in urban Michigan. And in West Africa, I work a lot at the intersection of agriculture, climate change, and food security. And in Michigan, I work at the intersection of also food security and health issues, I would say, health and nutrition. So that's kind of where I'm coming from and how I came to what I do. I would say that my work is motivated by these kind of points. which I'm sure is not news to you, since you all are in a very interdisciplinary program already. But we know that the current problems we face, in environment, in health, are not simple, right? They're defined by complex interactions and nonlinear changes. So we can't kind of know what tomorrow is going to look like necessarily by looking at the past and how it's changed linearly. At the same time, these problems involve multiple systems and require an interdisciplinary approach. So, a simple example I use a lot in my class is the problem of obesity, right? Major public health problem in the United States. Well, that touches on issues of, urban infrastructure design. It touches on issues of our agricultural system. It touches on policy issues. It touches on, household level decision making, economics, all of these different things that you need to incorporate in order to adequately address this problem, right? And because of that, because these are complex problems, they're often resistant to intervention. So many public health problems that you all deal with, I'm sure you can think about the fact that people have been trying to do something about them for some time, but those efforts may have been met with some resistance, probably because there are many systemic things keeping the structure of the problem in place, okay? And a last point, often these problems involve value judgments and firmly held beliefs among both scientists and stakeholders. I'll give you an example in a little while. I'm working on the water crisis issue in Flint right now. There are very strong emotions around this issue. There are very strongly held beliefs and values that people feel have been violated. And so it's hard to kind of take an objective scientific approach in that context without considering explicitly those value judgments that people are holding. So I would argue that in order to address these types of problems, we need approaches that incorporate an understanding of these complex and nonlinear dynamics. We need approaches that are holistic rather than reductionist. And to be clear, I am not knocking reductionist approaches. Clearly, science has been using these for hundreds of years. They're extremely powerful. We can learn a lot using a reductionist approach, breaking things apart into pieces and looking at the pieces. But I would argue that in the academic and scientific arena, we've tilted way too far towards that end, and we need also approaches that are systemic and holistic, and we need to use them both, okay? And I'll give you an example of that in a little while. We need to figure out how to identify levers of change at multiple scales in these systems. So you can't control systems, you can't design them necessarily, but you can nudge them, you can push them in the direction you want them to go. And so how do we do that in a most effective and efficient way? And we need processes that help us incorporate diverse values and build consensus among stakeholders in terms of what is the right thing to do, what is the best thing to do, what is the most effective thing to do. So I would argue that kind of the traditional models of science, which involve scientists, us being in our offices and our labs, designing research, interpreting our results, and then just kind of delivering them to policymakers and saying, okay, here you go, here's the science, all right, my job is done. I would argue that's not the most effective approach for dealing with these types of problems. We have to work side by side with decision makers in kind of new collaborative ways. And this is what I try to do, sometimes more effectively, sometimes less effectively. And just a shameless little plug here, Michigan State University is hosting the second annual Innovations in Collaborative Modeling Conference this summer, June 14th to 15th, in which we're going to be talking about a number of these types of approaches, jointly modeling between scientists and stakeholders. So if you're interested, please check out the website, and we'd love to have you join us in East Lansing this summer. So participatory modeling, participatory systems modeling, really comes out of the tradition of participatory research with which some of you may be familiar. This is a kind of classic diagram from Arnstein looking at the different ways that citizens or stakeholders can be involved in the research process. And when we conduct research in partnership or collaboration with stakeholders, often what we're trying to do is kind of get from this section of the ladder up here to a more partnership or even delegated power model, where we're turning over design and control of the research to people who have to live in the systems that we're researching. I think probably we all would agree that we don't want to manipulate people with our research. But a lot of research, I would say, probably falls more in the kind of informing and consultation arena, even work that's very applied. And that can be fine. There's nothing wrong with that. But again, if we're really trying to deal with these complex problems over time, maybe we need to move a little bit more of our research into the partnership realm. And in the participatory modeling arena, there's a kind of saying among modelers that the one who models is the one who learns about the system. And we've all had this experience, all of us who model, that you're looking at the complex dynamics of a system and you have this aha moment, like, this is why this outcome is happening despite efforts to prevent it, or this is why the system is behaving as it is. And so why not have the decision makers and the people in the system involved in those aha moments, in those learning moments, right? There's also a justice argument here. So if our models and our science are going to be used to make decisions about systems that impact the lives and livelihoods of the people living in those systems, then ethically, shouldn't they be involved in constructing that science? Shouldn't they be involved in having a say? There's a buy-in argument, right? So the idea that if decision makers are going to listen to you, if they've been involved in creating the model, they might trust it more, they might believe the results more, they might be more willing to implement decisions and solutions based on model output. I gave the example of the situation in the Philippines where there actually was probably incorrect social science information about how farmers make decisions that we were able to kind of counteract by actually talking to people. And so I would argue that you can come to more robust scientific conclusions if you involve stakeholders in your models. And there's also a social learning process that we try to design where people can learn from one another. And that in itself can be very valuable. So scientists and stakeholders learning from one another. Excuse me a minute. So this diagram is from one of the kind of seminal books on participatory modeling by Marianne van den Belt. She's in New Zealand now. And this book is called Mediated Modeling. So mediated modeling is really another term for participatory modeling. And her argument here is that when you're making decisions about, say environmental or health problems in the context of complex socio-ecological systems, you're trying to achieve a high degree of understanding of the system and also a degree of consensus about what should be done. And her argument is that, kind of the status quo is nothing gets done, But an expert modeling approach up here in the left-hand quadrant, in which a scientist or a modeler might sit in their office, sit in their lab, design a model, come to conclusions, deliver those conclusions to stakeholders. That might be very scientifically valid. It might be, a really great insight that model achieves. But those recommendations may never be implemented because people don't trust it or don't believe it or don't understand where it came from. It's a black box to them. On the other hand, if you have some kind of mediated process in which stakeholders come to consensus on goals or problems, they may not actually know how to achieve the goals that they have given the dynamics of the system, so they don't have that information. So she argues that participatory modeling approach can kind of combine the best of both worlds and achieve both consensus around goals and problems and also an understanding of how you get there. This diagram is from another kind of seminal paper on participatory modeling by Voinov and Bousquet. And this is just, there's a lot here, but the point here is that this is really an iterative process of designing a participatory modeling research program. It involves, I would call it a dialogic process between scientists and stakeholders in which you keep talking over the different steps of the model, the different steps of the research, and achieve clarity on what you're trying to do and what the model is telling you. And so one point to make here, and I'll come back to this at the end, is that this can be a lengthy, time-consuming, and sometimes costly process. So, although I believe in its power, it also may not be appropriate for every type of problem because it really is costly, both for scientists in an academic structure where we have to churn out papers and projects, right? And also for stakeholders, often who are very busy people themselves, and to ask them to come to 3 workshops in a year is a lot, So we'll talk about that more later. Okay, so the particular type of modeling that I do is called system dynamics modeling. How many of you have heard of system dynamics modeling? I'm curious. Okay, just one. Okay, has anybody used it? Have you used it? Yeah.
Been involved in projects where it's been used, but
okay, great. Yeah, I'm curious. I was curious because it has been used in the health sciences, probably I would say farther back than it's been used in the environmental sciences. It's been around for a few decades. It comes out of kind of more of the business management literature. out of MIT specifically. But its hallmarks are, there's kind of three characteristics of system dynamics modeling. Feedback, stocks and flows, and nonlinearity. So by feedback, what I mean is a mutual causation relationship in which you have A causing B and B also causing A. So if you think about it, this kind of thing is kind of the bane of traditional statistical approaches, right? In your first year statistics class, what do you always learn when you're doing regression? You want to get rid of endogeneity, right? Because that's going to screw up your results. Well, in system dynamics, we recognize endogeneity and we build it into the model. We say, we know this is happening, and we're just going to run with it. So for example, classic feedback loop here is the thermostat in your house, which you may not deal with so much here in Southern California, but trust me, in Michigan, we deal with this quite a lot. You set your thermostat to the desired temperature of the room, and when the temperature of the room falls below that level, then the heat turns on and raises the temperature of the room, which in turn reduces the level of heating. So this is what we would call a balancing, or sometimes called negative feedback loop. And systems that are dominated by these kind of balancing loops tend to achieve equilibrium or tend to exist in a kind of equilibrium space. Okay? On the other hand, you might have a positive or reinforcing feedback loop. And a classic example of this is the relation between population and births. So the more people you have, the more people are born. Then you have more people. Then you have more people born. And on and on. And a reinforcing loop dominated system tends to exhibit exponential growth. Now, of course, in any system, there are typically both types of loops. There are typically both reinforcing and balancing loops. So the behavior of the system will depend on which is dominant at any given point in time. The other aspect of system dynamics modeling is that it can represent a flow between different groups of things. So often when we're talking about health issues, we might be talking about groups of people. So people flow between different kind of populations. And a very classic example of this in the health sciences is the SIR, the SIR, susceptible, infected, recovered model, which represents infectious disease dynamics. Has any of you encountered that? Okay. It was used, for example, I think it was the base model used to estimate Ebola deaths in West Africa when that epidemic occurred. So it models people moving between those three types of populations, susceptible, infected, recovered, over time, so you can look at how the dynamics of the disease might play out given different factors. And just to show you that the model itself is a quantitative simulation model, which you run on the computer, usually using specialized software. You can also use programming. But it's based on a qualitative model, which is called a causal loop diagram. And this is basically just a map of the system and the way it behaves. So these arrows represent causal relationships between different variables. This is actually a stakeholder constructed causal loop diagram from Zambia for a project I worked on deforestation. So this is usually where the stakeholders first enter the system, the process that I use. They are the ones who design the structure of the model. So they're the ones that tell me what's going on in the system, how is it working, what is causing what, and what are the feedback loops that are operating. Okay. So I'm going to talk about a few case studies here. I think I have time. If I don't, I might skip one. So this first project is one that's been over for a couple of years. It was a short project. This one, the food security modeling, just wrapped up, or we're just kind of finishing the final stakeholder process now. And then this project around the water crisis in Flint is still going on. We just started it. And we actually just put in a proposal for a rapid grant to take it further. So the Mid-Michigan Heat Model was a project that I conducted in partnership with the Michigan Department of Environmental Quality and what was then the Michigan Department of Community Health. Now it's the Michigan Department of Health and Human Services. Things have changed. And it was funded by the Great Lakes Integrated Science and Assessment Center, which is a NOAA-funded center for bringing climate information into policy processes. And so the problem we were looking at here is that extreme heat events actually kill more people than any other natural disaster in the United States. I didn't know this before I started this project, but I learned that. Even in Michigan, and perhaps especially actually in northern cities, I learned this is more serious possibly in a city like Detroit compared to a city like Phoenix where everybody has air conditioners. And as you can see by this chart, the people most affected tend to be seniors. There are other groups of people that are affected by extreme heat events, like those who work outside, pregnant women, children. But for the purpose of this project, given the demographics of Detroit, we focused on seniors. And so our goal was to develop a system dynamics model that would describe heat deaths and heat illnesses over the course of a heat event in Detroit, and also identify vulnerable populations and how they might respond to a heat event, and test some policy and management interventions for their effectiveness. So we had just a very short timeline for this project, just only a year. So we kicked it off with interviewing key stakeholders, particularly county health officials and city health officials around this topic, and we started constructing our causal loop diagrams based on those interviews. And then we brought it back to some other stakeholders to kind of cross-check it. And once we had the qualitative diagram, we went to the literature and we went to data to start putting numbers into it. And we then held a final stakeholder workshop in which we invited a number of people who are involved with both health and issues around seniors in Detroit to work with the model. So this is a picture of the model interface. So this is built with a program called Stella, a modeling software called Stella. It does not have the best interface graphics out there, but it does the job. So this is a way that people could actually interact with the model, manipulate these different aspects of the model in order to look at different scenarios. And again, underlying this model structure is a causal loop structure that was developed in consultation with stakeholders.
Can I ask, is it purely deterministic or is it a stochastic?
You can put, so right, so typically it is deterministic. You can enter stochasticity using different mechanisms. For interacting in this way, it was deterministic because we wanted to be able to compare model runs. Yeah. So the core of the model is kind of similar to, in a way, to the SIR model, the infectious disease model, that you have a population at risk of heat events. In this case, it was our senior population. When a heat event strikes, they become vulnerable to being affected by heat. And then in order to take action to mediate their risk, they have to both perceive the risk, they have to be able to act, and they have to be willing to act. So in other words, they have to know that their health is at risk. They have to, for example, be able to get themselves to a cooling center or a central location where there's air conditioning. They don't have an air conditioner. And they have to be willing to do that. So they have to actually get out of their house and do it. If they do all of those things, then they are unaffected. But if they don't do any of those things, they may become affected. And so this is what the model output looks like. And this is a very typical graph that you get out of a system dynamics model depicting how some variable that you're interested in changes over time. So on the bottom axis here, we have number of days from the beginning to the end of a heat event. And the red line represents deaths as a result of a heat event, and the blue line represents hospitalizations. And so if you manipulate the different variables in the model, you can see these shapes change. I'll give you an example of that with the next model. So what did we learn from this? Well, our decision makers who were involved in the final workshop, it was interesting. There was kind of a group think among the decision makers, even when we interviewed them separately, that what is really needed is more cooling centers. Like the primary problem in Detroit, most people told us, is that we don't have enough cooling centers. So for people who are vulnerable, they don't have air conditioners. We need to just open more. Well, this may sound obvious when you say it, but one of the things the model revealed was that more cooling centers are not going to help if people can't get there and don't want to go. So you have to change some things in tandem with opening cooling centers in order to really reduce heat deaths and heat illness. And we also looked at the importance of other interacting systems. So both, for example, the electrical grid, if there's a brownout, suddenly you have a lot more people who are vulnerable. And also human behavior. So what people think about their own risk and how they behave in relation to that is also important. So there may be an educational component that needs to happen. And what we learned from the stakeholders is that there are critical spatial dynamics to this problem. And unfortunately, with system dynamics software, you can't really represent that explicitly. So really, more advanced version of this model would incorporate some spatial aspects and perhaps some GIS data. And we also learned that it was really important to design the interface in a way that people could manipulate it easily. We went through a few iterations of that before we kind of got it right.
What about factors, personal factors, like doing their own thing without having any cooling centers? How was that?
Yep.
Created?
Yeah, we represented that as well. So there are different coping mechanisms that people could take at home. You know, for example, personal air conditioners was a factor.
And what about showers?
I don't think we represented showers in the model,
Well,
but yeah.
Yeah.
Okay. Yeah. No, that's very fair. Yeah. So this was, like I said, this was a kind of quick 1-year thing. And ideally to take it further. Oh, the other thing we looked at was mitigation of the urban heat island effect also. So kind of more citywide.
It's become, it sounds as if there were some people who wanted to make money from all of this too.
Yeah. Well, yeah. I mean, that's we were looking at the air conditioner issue, and there are some even proposals to distribute air conditioners to people. Obviously, that's a very expensive solution. Yeah.
And assumes that they can afford the electricity too.
Well, exactly. Yep. Exactly, and that was represented too, is whether people are going to use it and what how they feel comfortable, paying that electricity bill for the air conditioner. Yeah.
I was wondering, were you able to build in any social isolation into the model? Because when you look at the Paris disastrous event in 2003, the biggest problem was that the elderly people were isolated because it occurred when most of the French people go on holiday somewhere else. So they were
right.
And that seems to be a persistent problem in Chicago.
Yep. Yeah. Right. We did a little bit in the sense that we tried to represent that with people's ability to get themselves to, both people's perception of being at risk and then ability to get themselves to a cooling center. So we tried to represent, how many people have folks checking up on them and are able to take them to a cooling center, for example, as opposed to being more isolated. But the more kind of indirect aspects of social isolation in terms of people coming and helping you were probably not represented here. Yeah. So, okay. Yeah, good questions. Yeah. And, it's very interesting because my expertise is really in kind of a more methodological approach. And so a lot of the problems that I approach a little bit as a novice, and I learn about them on the job. I would say probably food security, agriculture a little bit less so. I've been working in that arena for a long time. But this was really new for me, and I learned a lot about heat and health from my collaborators who have been working in this field for a long time. So if I misspeak something, that's why. I kind of learned on the job along with them. Yeah.
One other factor you might, if you're going to follow this up, would be pet ownership, because that
yes.
people from going into the cooling centers and during wildfire events, which I'm not familiar with.
It is so funny that you mentioned that, because that is something that we actually did include in the model, and several people mentioned, and it was totally, it was a surprise when I first heard it, but then it made a lot of sense, yeah. Like you said, because people don't want to leave their pets behind. And so how many cooling centers have the option where you can take your pet with you is something we explored a little bit, yeah. Okay, I'm going to move on quickly to another project we did in Detroit in collaboration with a nonprofit called Food Plus Detroit. And funded by the Michigan Institute for Public Policy and Social Research. And this is a problem that my guess is, very familiar to those of you who work in LA as well. We are experiencing problems in Michigan cities being classified as food deserts, although I've been told by, urban food security people that's a very contested term. It's maybe not the best thing to use. But basically what this means is there is a lack of access to quality foods in the urban core, particularly fresh fruits and vegetables. And this is contributing to health problems related to poor diet. There are many overlapping and contributing factors, including economic and racial injustice in the food system, and also perhaps a lack of education about the importance of nutrition and preparing fresh, healthy meals. So these are problems that were identified by the Detroit Food Justice Task Force, which is kind of a coalition of folks in Detroit working on these issues. And just as a kind of aside, I have to say that Detroit has some of the highest levels of grassroots activism around these issues I have ever seen. It's really phenomenal. I mean, there are so many groups working on this and have been working on it for decades. And that's not something that you really hear in the popular media a lot. There's kind of this perception that it's only outsiders coming in to try to fix the problem. But I just want to give a shout out to all of the Detroit organizations that really contributed to this work. And so that's why we wanted to use a participatory modeling approach partly, because we knew that there's extensive grassroots knowledge about these problems that people have been working on for a long time, and we wanted to harness that and put that into a model. And we also knew that there are multiple interacting causes of, kind of the poor nutrition of Detroit households, and just a few that people have tossed out in these reports, poverty, racism, the construction of the food system, the dynamics of the urban core, that have been going on for a long time in Michigan, related to the collapse of the auto industry. However, when you get all these activists in a room, although they agree about the problems, they tend to disagree about what should be done and what should be prioritized, which was really interesting to me. So we thought that we would have kind of a structured conversation using a model around this topic. And so a similar process to the one I just showed you, we conducted some initial interviews, including my wonderful master's student helped out with this. And we held an initial workshop to do the causal loop diagramming. We then held a second workshop to look at the quantitative model and had the final report that we wrote vetted by the stakeholders we interacted with. So this is the causal loop diagram they came up with. This is unedited. This was straight out of the brains of our stakeholders. So obviously, to get this into a model form, we had to do some work with it. We had to go into the literature and look at some of these linkages that people identified and see if there's any evidence for them. And so the final, I'm just going to show you the model itself, since it might be fun to see what this thing looks like.
I'm curious, have you ever seen the systems model that was put together by, I think it's the U.S. Department of Agriculture on obesity?
Yes, I just saw that, yeah.
Maybe 10 times more
than exactly, yeah. Yeah, and so that's the challenge of these things, right, is that they can be intimidating to look at. So you sometimes have to kind of break them down and look at these individual components and how they interact before you kind of zoom back out. And usually when I'm in workshops with stakeholders, I do try to go in and look at it piece by piece so people can understand what's really going on here. But this is the model interface, similar to the model interface that I showed you guys before. So you can simulate the characteristics of a household in Detroit and its food choices. So just to back up a little bit, I'll say that from that causal loop diagram, one of the things we identified is that people were really interested in looking at household level decision making and food dynamics, and also regional level. So those are the two kind of scales. We said, okay, initially let's focus on the household. It would be good to see, if we can look at how people make food purchasing decisions and how that affects their health. So you can set these different household characteristics. So whether the person gets SNAP or public assistance benefits, for example, what their monthly car costs are, the wages they earn. Yeah, so there's a little slider bar here. And then you can simulate the model, and it should run. Yeah, there we go. And so you get a result that shows you the percentage of healthy meals consumed over on a monthly basis over the course of 24 months. And by healthy, we mean things that are prepared from fresh fruits and vegetables cooked at home. And there are 4 categories of food here that we simulated: healthy, convenience, fast food, and emergency food, which is you don't have food and you have to go to a food bank or have a neighbor provide you with a meal. So we gave this model to the stakeholder groups from Detroit in small groups. They got to play with the model. They got to test out some of their assumptions and do different scenarios. And so this was a really interesting process because it contained some counterintuitive insights, actually. One of which was that owning a car actually could make households less food secure because cars are expensive. Right? So if you're spending more of your budget, especially on a car that needs a lot of maintenance and repairs, that might leave you less of a budget for fruits and vegetables. And this is a little bit counterintuitive because people had often assumed that if you have a car, you can go out to the nice grocery stores in the suburbs and buy food and come back and prepare it. But if you're limited by your budget, that doesn't work. We also found that time was an absolutely critical limiting factor, and for any of you who are working parents yourselves, probably this is not a big surprise, but it's something that's largely kind of missing, actually, in the household nutrition and food security literature, which really surprised me. But the time limitations for both procuring and preparing fresh food was a big issue. So it was kind of like nutritional interventions or food assistance interventions without considering the time factor are not going to be very effective.
There's some literature on single parent touches on that.
Okay. That's great. Yeah. Okay. Yeah, and obviously for single parents, this would be an even more critical issue. And particularly adding in not owning a car and having to take a bus to a grocery store, your time budget for meal preparation just shrinks rapidly. One of the other interesting conversations we had with the stakeholder groups was how to put things like racism and cultural attitudes towards food into the model. So we had to really explicitly discuss the causal mechanisms that are operating there to impact the food system, and that was really interesting because people didn't all see it the same way. And we had a lot of, I think, very productive conversations around that. Okay, so I'm going to move briefly to the final project that we just started in Flint. So this is a collaboration with the Community Foundation of Greater Flint. And when we originally started talking about this project, we were talking about doing a food systems analysis similar to what we did in Detroit. And then, that was last summer we had that conversation, and then the water crisis hit. And that just overwhelmed everything. And everybody in Flint is absolutely scrambling around this issue now. And so instead of doing that, the food system intervention, we decided to use some participatory systems modeling tools to capture community concerns and relay them to the groups that are trying to take action around this water crisis. Because one of the things we saw is that there's a real lack of communication between state agencies, nonprofit agencies who are trying to help, and the actual communities on the ground. And there's a number of reasons for that. So I'm working here with Stephen Gray, who's a fuzzy cognitive mapper, also in my department, another participatory modeling approach. I'll show you an example in a minute. And we also wanted to understand where the communities were getting their information about the health issues around the water crisis and who they trusted to provide them information. So probably a lot of you have heard about the Flint crisis. It's a very involved story. Living in Michigan, there's a new article about it in the paper every single day, and it's an ongoing saga. But the short story is basically that, as you probably know, many communities in Michigan have been in a state of economic crisis for some time. And in 2011, the Michigan Governor Snyder appointed an emergency manager for Flint, which is somebody who can oversee the running of the city until it gets its finances kind of back in order. Well, in 2014, Flint had been getting its water from Detroit, had been buying water from Detroit, and then was piped up to Flint. Due to a series of negotiations and disagreements, that water was cut off, and Flint decided to go with its own water authority. In the interim, while they were building the new water processing plant, which would get water from Lake Huron, they said, we'll just get it from the Flint River. So immediately after that water source was switched over, however, residents started complaining about color, odor problems. They were starting to get rashes and other dermatological problems. There were boil water advisories issued, etc. General Motors, a few months later, stopped using Flint River water because it was corroding their auto parts. In February 2015, the EPA got involved. And again, I want to emphasize, all of the involvement of external people here was due to the activism of Flint residents. It's not like people were checking up and saying, hey, what's going on in Flint? Let me go in and find out. These were Flint residents who were reaching out to scientists and saying, please help us. Something is wrong here. We need your help. So it was Flint residents who reached out to the EPA, who were shocked that they actually were not treating the water with the appropriate anti-corrosive agents, which would have kept the lead and copper from leaching into the pipes. So they wrote a letter to the city saying, this is in violation of the federal lead and copper pipe guidelines. You need to start treating the water. A resident of Flint named Leanne Walters brought Mark Edwards from Virginia Tech in to test the lead levels in Flint homes because she didn't trust what the state was saying, that it was fine and there was no problem. Dr. Edwards found actually there was a significant problem. And then we had Dr. Hannah Atisha, who was actually at Michigan State in the Hurley Center in Flint, found high blood levels in the children, blood lead levels. And then in October, the whole thing kind of blew up when the state actually said, okay, yep, this is an emergency. Don't drink the water. that's when the donations of bottled water started coming in, and that's what people are still using. And just this past couple of weeks, there have been criminal charges filed against both state and city officials for their decision making. Yeah.
If I understand it, switching back to the Detroit water is not going to work now because the main problem was that there was basically like the change in the chemistry of the water changed all. And I'm not a chemist, so but changed the cations that have been in these pipes for a long time. But they started leaching all of the lead that it was basically being held by all these microbiota and the chemistry was holding it in place. And they switched. So now switching back after the pipes have already had the chemistry changed is probably not going to be the solution either.
That's exactly right. So they have switched back to the Detroit water, but the pipes have been so compromised that there's still a lot of lead in the system, so it's still not safe to drink. So every single person in Flint is being recommended to still use filters and bottled water for everything, for brushing your teeth, for drinking, for bathing, for cooking. The governor just recently declared, hey, the filtered water is safe, but people still don't trust it because there are probably other pathogens and contaminants in the water. So people are still complaining about rashes, about boils, about infections. And I just talked to a microbiologist recently, and she said, yeah, basically anything could be in there because, like, you disrupted the protective coating on the pipes, and it could be fungi, it could be bacteria, it could be, anything.
It's the classic case of the actual source water may be good, but the distribution system is the problem.
Exactly. And we know that that's a problem. And I just heard recently that they finally mapped out all of the pipes in Flint. They went to the city, the basement of the city hall and dug up all the records and mapped it all out. And there are some wooden pipes in there. I mean, these things are like more than 100 years old. It's just incredible. And this is not the only American city that has this issue. I mean, there are other Flints out there, waiting to happen. So understandably, with all that's gone on, there are very low levels of community trust in state officials, and there's still very confusing messages being communicated. Here's an example. The city of Flint still has on its website a place where you can navigate to this boil water advisory where they say, hey, boil the water as a precautionary measure. But boiling water actually concentrates the lead in the water, so you actually should not do that. It's not a safe way to get rid of lead. And there's a billboard to that effect outside of town. So what are you supposed to do with these contradictory messages? I mean, it's really a problem. And that was one of the things that emerged in the kind of community mapping exercise that we did. So this was one workshop of 4 that we did in Flint. We conducted them in churches around the city. And the Flint residents constructed this map. This is similar to a causal loop diagram. And one of the things that was really identified here is that this is putting an incredible amount of psychological and emotional stress on them, understandably, because they just don't know what they should do. They don't know how to protect their families. They don't know how to protect their children. People are just in a really dire strait. We also asked them to diagram what they thought the state officials saw this problem as and how they were addressing it. And predominantly they saw that the state officials are treating it like a publicity problem. They're not particularly interested in solving the health issues. They're interested in kind of containing the public outcry. Now, whether that's accurate or not, we're not going to comment on, but clearly there's a real lack of trust and communication here. And that was borne out in some of the survey results that we did, where we had a Likert scale here who said, completely distrust this entity was a 1. We probably should have made it a negative, actually. And completely trust was a 5. So the state officials are getting pretty low scores here. People don't trust them. They don't trust anything they say. So even if they're trying to communicate information that's accurate scientifically, people are not going to listen to it. I guess the good news is that they trust their neighbors and friends, and they seem to trust university scientists. So that's maybe a silver lining. So we're going to go forward with this work in Flint. We're going to synthesize the findings from the different workshops and hopefully communicate kind of up the food chain what some interventions might be that would convince the community that the problem is being addressed, and maybe also bring them into the kind of trust-building process. So just to wrap up here, I know we have to get out of this room. I will say that I really enjoy this work. I think it's a powerful tool, but it can take a significant amount of time, and it can be costly, as I said before. It can be challenging to manage stakeholder expectations sometimes, and we're not trying to solve people's problems, we're just trying to advise around the system. And I always struggle with this bottom part here. How do you strike the balance between building a model that has predictive value, so it has quantitative and scientific information in it, but also people can look into it and understand it and really use it for their decision-making processes, so it's not a black box. That's a tricky balance to strike, and I don't think there's an easy answer. So with that, I'll conclude, and I don't know if we have any time for questions, but I'll be sitting around. Yeah. Yeah.
How do you validate the model itself?
That is a great question. So with this type of model, there are different ways of validating it. So one is we want to make sure that if we have data around the system, we want to make sure that the way the model is behaving is consistent with the way we know the system behaves. So we might compare it to either historical data, historical data in most cases. We also want to check, kind of face validity. So we often take it to experts in the field and say, does this make sense to you? Is this consistent with what you've seen in your work? We also conduct what's called extreme behavior tests on it. So if we push the model boundaries, like push it out to 100 years, push one of the parameters way up, does it behave in a way that's kind of logically consistent with what we understand? So there's a lot of ways to validate it. Those are a few of them.